Hello, I'm Dr. Paul Coulter. I'm going to discuss lacing patterns today. Uh, Lacing in podiatry practice is extremely effective care. I use it all the time in my practice. I've tried to build a sports medicine practice, and with athletes, you can do a tremendous amount with lacing patterns to give them better fit and reduce their risk of injuries with lacing patterns as well. Especially when an athlete comes in and they're concerned about the fit of their shoe, it's extremely easy to sort of build the lacing pattern around the needs of their foot. A lot of times what I like to do is show the patient certain aspects of their shoe. One of the things that we like to discuss is the throat line of the shoe, which is the line that runs right here. That's the top edge of the shoe, and the lacing going all the way up to that point. In a lot of shoes, you'll see a back eyelet here. And I always explain to patients that you really want to try to avoid that back eyelet because of the way the material is pulled around the foot. If you lace back to that point, it will cause a gapping in the back where the heel will slip a little bit more. I see it a lot of times where patients are trying to do a runner's lace and they don't realize that they've laced back, which is the pull of that is this way instead of the pull of the heel, which is what you really want, which means that you want to go to the highest eyelet, not the one that drops to the back. This is a technique that I like to use with patients that have a higher arched foot or have a bone prominence, where we do a skip technique like this. Skipping around the area of the bone prominence, keeping the laces off of that area because of the way that the nerve runs down over the top of the foot there. A lot of times athletes will complain of numbness or tingling, or even some of your patients that are just doing stair climber or workouts where there's a lot of stress forward on the foot. It will pinch that nerve and cause numbness and tingling. We'll do a skip technique like this for the patient, and then basically do what's called a runner's lace or an anti-pronation lace, which is where you make this loop at the top eyelid and then cross over to each side using the lace as a sort of a cinching effect like this to tighten that around the heel. And that also helps with heel slippage as well. Other lacing patterns that you can implement are this technique, which is for a patient that has higher arched foot structure. A lot of these lacing patterns you can find online. There are several really good videos on YouTube that kind of show how to do the lacing patterns for a higher arch foot structure. And this is just an example of that, where the laces kind of come across and they allow less stress over the top of a higher arched foot structure. A lot of the lacing patterns that I like to implement, I try to gear toward the needs of each patient, whether it be a patient that's playing soccer or just a patient that's out running for daily jogs. A lot of these can be put together. So you can have one lacing pattern that might be effective for like a flat foot, which is this anti-pronation lace that we like to implement. And then the higher arch foot structure, and then the skip technique. Those are probably the most common lacing processes that we implement. A lot of shoe manufacturing today is implementing different eyelets, and you may see the technique where the laces are running through tabs, which is originally from the Scottish dress shoe, where they basically took leather and rolled it and then would put the lace through that rolled leather that was stitched together. A lot of manufacturers are using that technique in their shoes today, especially running shoes. And you can still use a lot of these lacing patterns in no matter what lace they're using, or whether they're using an eyelet or the Scottish dress shoe. The Gilly lacing system is what it's called. So these are some of the lacing patterns that can be implemented to help with different varying foot ailments. There are multiple resources that are available. I like to give out handouts to my patients that you can find online that give them the diagrams and show them exactly how to implement a lot of these different lacing patterns. Your podiatrist can find a lot of these, probably do have handouts for that. And we do recommend that you come in to see your foot professional to have these techniques implemented. A lot of times with athletes, they're really surprised at how easily and quickly we can help them to find and the relief that they're looking for and give them a better fit. And I always explain to my patients that we could fish for you and feed you that day, but if we teach you how to fish, you'll feed yourself the rest of your life. And these techniques will really help a lot of your athletic patients to use these ideas to give them better foot health.